Welcome to Charter California Edition. My name is Brad Pomerance. We are joined by Alan Lowenthal. He's a member of the United States Congress. Throughout this half hour, we'll be speaking about the Affordable Care Act. We start with Congressman Lowenthal. And so I want to speak with you at first about the exchanges.
Yes.
If you watch the national press, there's a lot of focus on healthcare.gov, which operates for 36 states. 14 states have their own exchanges. Covered California, for example. How's Covered California going? Because we don't hear a lot about it.
Covered California is going very well. Remember, we're talking about a comprehensive approach that California has done. It increased its Medi-Cal recipients, which would be also, as you increase Medi-Cal and get people into Medi-Cal, under the same criteria of and same services as the Affordable Care Act, you're really complementing the and California.
Well, we accepted the expansion.
And we set it in motion. The same thing about setting up our own private marketplace, which is Covered California and the marketplace, doing outreach, trying to reach into every community. I think there was a real commitment in California to make it work. There was a lot of testing of the platform before it went public.
So let me ask you, let me ask you specifically though, because the one problem California is having, it's not the website.
Yes.
The website's working.
Yes.
The one problem is the notion that we need more enrollment counselors. Now look, I know that you're in Washington, D.C., and so you're not here and you don't have any involvement with the enrollment counselors, but look, you as a congressman representing California, we have a vested interest to make sure this works. And what we hear is folks still want to talk to someone. Health insurance is complicated. And Covered California had said they would have, I think, 16,000 enrollment counselors, and they just don't yet.
That's right.
So can anything be done?
It is being done, and you're right. But remember, we're talking about a process that although the website was up and everything was running, the first time you could go online or really even look at what your options were was October 1st.
Right.
So we're now just, you know,
a couple months in.
Just a month or two in. And so what we've seen is Covered California has spent the greatest amount of its time doing the outreach now, just outreach.
Right.
In the last couple of weeks has been the completion of the training of their enrollment count. And we now remember, normally there is a 3-month period for enrollment each year after this year. That's from the beginning of October till January 1. Because we knew this was a new experiment, the enrollment will now go for another almost 5 months more until March 31st. Therefore, and we know from our experience that the greatest amount of enrollment comes after people shop around, look at it. They need to have somebody to contact. We also need to do much more outreach into existing insurance agents and to make sure that they have all the information.
Let's talk about that March 31st date, because while California's exchange seems to be running somewhat smoothly, healthcare.gov is not. And there have been rumblings amongst your colleagues in the United States Senate that we should extend the deadline, we should look at even canceling the individual mandate for the year. The president has been very firm that that's not workable because, as I understand it, the insurance market set its rates based upon the mandate being in place. And so where do we go from here?
Well, remember, as you started out, Brad, 36 states chose. This is really a state, the federal government sets the criteria, and it really was to be state-based. Only 14 states, I think, have agreed to doing that.
The exchange, their own exchange.
And to really accepting the responsibility of really wanting to run all of this and promote it. And so what's happening in California is quite different than the rest of the nation. In those 36 states where there is a tremendous tension between the state government and that, I don't know how that gets resolved, a lot of that. I think it's the law of the land, and they need to be able to kind of figure out how to accommodate that and to do that.
But here's the challenge. I mean, recently I think it was 16 U.S. senators.
And everyone will be watching California's enrollment numbers, because if it can work in such a large urban state like ours, and that's what I'm focused on, making sure it works, so then we can go to the rest of the nation and say, when these numbers come
No doubt. But look, 16 senators went to the White House recently and said there is a crisis in confidence as it relates to healthcare.gov. And many of these 16 Democratic senators have tough re-elections in 2014.
Yes.
And so, you know, Jean Shaheen, senator from New Hampshire, I'm not sure if she's up for re-election, you know, but she's fairly safe, and yet even she is saying we may need to postpone this individual mandate. I mean, it's getting really dicey.
I think because and that possibly could happen. And I think that, again, there are unique situations. California, we are blessed by having, I think, throughout the state, 11 insurance companies that want to be on it. Now, not all.
Part of Cover California.
We have 6, I think, in the LA region. New Hampshire has 1.
Interesting.
1. That's all. Because it's such a small market to begin with. So if they can't get things together, they're in a crisis.
I do want to ask you about one point. I think most people believe that healthcare.gov, it will be remedied.
Oh, yes, it will.
Somehow, some way.
The
one point that has really angered folks, both on the left and the right, is President Obama's statement that he made repeatedly during 2010. If you like the plan you have, you can keep it. The reality is, sir, that statement really should have had disclaimers attached, dealing with grandfather clauses, dealing with unless your plan is substandard as defined by the Affordable Care Act, because there are a group of people, it may be small, that can't keep the plan they like. Where do we go with this?
Well, let me say I'm one of those people that were angered. Because it was not just the fact that the president in 2010 had stated this, it was the fact that I always knew that those who had in the individual market, there were 2 categories. There were those that had substandard, and there were those that had individual policies in companies that were also in the marketplace, but they were both. That were set to run out sometime this year, but were the policyholders thought that they would have that policy through their life. Those policies also were canceled. And those of us in the Congress who are big advocates of this didn't know this was happening. I think that was a sense of that they'd better get their act together. This is disaster.
But how do we get around this question?
Well,
because it really is. You know, look, healthcare.gov, again, that was a technical failure. This is a very different scenario. This feels misleading.
It was misleading for a certain number of people. I think that really what needs to be done, there are certain things that can be done. One is that this will work or not based upon that we get everybody enrolled in the system. And that we make sure that we have good oversight over the system to deal with these kinds of problems as they emerge. That is real. Some states can do that better than others because they have strong insurance commissioners. And one way California will be able to deal with these kinds of crises is what Insurance Commissioner Jones is proposing to complement the Affordable Care Act. He now has gone to the insurance companies and asked them not to terminate those who have legitimate policies, at least until March 31st. He would like to extend it out even longer. He would also like to say that a lot of people are going to blame the Affordable Care Act for rate hikes because now they're being changed. All other insurance in California, if an insurance company wants to have a rate hike, it has to go through the Insurance Commission, except health. The people of California will have a chance this November to have more transparency and oversight over the kinds of policies, when they're going to be terminated.
Prop 103 dealt with auto regulation. And I guess some managed care plans.
That's right, but it did not. So I believe that where we go from here is if we really want to know that this is there will be changes, there will be unintended consequences. I would like to have in place a process by which an insurance commissioner could review those.
His name is Alan Lowenthal, Congressmember for the state of California. When we come back, we'll be speaking with one of your former colleagues, a professor at Cal State Long Beach, Professor Britt Rios-Ellis. I'm Britt Pomerance. We'll be right back on Charter California Edition. Welcome back. It's Charter California Edition. I'm Brad Pomerance. We are joined by Britt Rios-Ellis. Many titles, many important titles. She is the Associate Dean of Health, Equity, and Research Programs at Cal State Long Beach. Also Director of the Center for Latino Community Health and the newly established Centro Salud es Cultura. Bottom line is, you have been focused for decades on health inequities.
Yes, I have
Let's
been.
talk about that, and we'll tie it into the Affordable Care Act. Give us a sense of the status of our Latino neighbors in terms of access to health.
Well, unfortunately, they're the most likely to be uninsured. So they're the most likely to lack access to health care. They're the most likely, we have tremendous rates of obesity, diabetes is very high. For every Latino child born in the year 2000, 50% of them will have diabetes within their lifetimes. So we have dreadful statistics around those parameters. Now, around cancer, it's a little bit better. Around heart disease, it's a little bit better. So we're seeing, there's a really interesting paradox wherein we see Latinos actually live longer than whites, about 2.5 years, 5 years longer than blacks, but there are definitely these disparities that tend to increase as folks become more acculturated to our ways.
And that is what I wanted to ask you about. You gave me that headline before. I would have thought, when I look at the very tasty Mexican diet that I enjoy as an American, cheese and sour cream and fried.
Those were added. Those have been added. Yeah, a lot of those things. If you look at the traditional indigenous diet in Mexico and throughout Latin America, it's a very, very healthy diet. So when we look at how folks acculturate here and the diets that they have access to, now definitely Latinos are more likely to live in food deserts where there's a high rate of fast food. They don't have access to fresh fruits and vegetables. And unfortunately, our healthy food now is much more costly than our unhealthy food. So, you know, that is a real issue.
So in a somewhat perverse way, if a Latino family assimilates, as we think about that, maybe they get access to insurance, but they start eating our diet, which can be less helpful.
Absolutely, absolutely. And what we see too is there's a loss of fundamental cultural values. When I look at the Latino community, especially the immigrant or fairly low acculturated community, there's a lot of respect.
And
there's
love.
a lot of love. There's a lot of networks of large extended families and support systems.
There's no
that
doubt.
There's a real sense of belonging. There's a sense of respect, a sense of trust that often gets lost as people acculturate here. So that's why our center is called Centro Salud es Cultura, because
you would
we
have expected
recognize
to keep health and culture.
Oh, health and culture to me are so, as a Latino wannabe, they're so intertwined, I've learned so much from my Latino side.
I want to talk about insurance, though.
Okay, great.
Because you mentioned that Latinos have high rates of lack of access to insurance.
Absolutely.
Why is that? Is it employment? Is it documentation?
Unfortunately, well, it's both of those issues, but it's not employment. Latinos are the most likely to be working full-time and to lack health insurance.
And that's the types of jobs they have.
It's the types of jobs they have, and it's the fact that no longer in the United States, like it was when you and I are growing up, that employment has insurance attached. So I'm really excited about the Affordable Care Act because I think it will mean that we will have 15, 16, 17 million Latinos eligible. Now, there's still the undocumented. There's still tons of families.
And let's be very clear on this, on the undocumented question. As I understand it, the Affordable Care Act specifically excludes undocumented.
Yes, the undocumented are not eligible for the Affordable Care Act. Now, nor are those who are in that 5-year waiting period. They're recent citizens, and they won't be eligible. So not just residents, but citizens.
So if the immigration reform that passed the Senate somehow makes it out of the House, there's still a waiting period?
Absolutely. And I would say the state of California, the ability for us as a state to succeed economically, jobs-wise, all of these things is really dependent on the Latino community.
I want to go back to the Affordable Care Act because we know that, as you said, large numbers of Latinos do not have insurance. I think we have 7 million uninsured in this state.
Absolutely.
And so what's important is that the message get out that Covered California is functioning.
Yes.
Healthcare.gov may have its problems, but do we have a sense as to whether there is outreach to our Spanish-speaking communities, or for that matter, any non-English-speaking communities?
I've been on TV Azteca, Telemundo, Univision's doing a wonderful job in terms of getting the notice out. And I think that we really need to recognize that Univision, for example, is watched more than any of our national news.
It is
right?
true.
Just because of the population.
No, it is true. And less competition, obviously. I mean,
Absolutely.
and I got to tell you, I mean, I digress for a second, but I've judged the local Emmys, and I have watched Univision newscasts. They are outstanding.
Yeah, absolutely.
They are outstanding.
Yeah.
And so these are top-notch newscasts.
Absolutely.
And so you said Telemundo Univision's getting the word out, advertisements are being placed, but still there's a bit of nervousness. I mean, a lot of folks who come here, they may have lived in oppressive regimes in Guatemala or El Salvador or whatever it is. And so the notion of going onto a website and signing up through the government, that could be foreign constitutionally.
Well, and I also think that we need to look at ourselves in the mirror in terms of how we've treated immigrant populations and Latino populations. So, you know, there were things that happened in the 20s where Latinos
deported.
Crossing the border were literally sprayed with kerosene, and some of them lit on fire.
Oh, they were deported. I mean, we know that.
Yeah,
There were mass deportations.
Mass deportations. So when we look at the history of how the United States has treated immigrant populations, it hasn't always been a friendly one. So even though, you know, we might not think our regimes are oppressive in any way, the experiences of many have been very oppressive.
So there's the question of the exchanges, and we know that the exchanges have certain subsidies attached.
Right.
But there's also the Medi-Cal expansion. And for better or for worse, many of our Latino neighbors may be able to access that Medi-Cal expansion. Is that message getting out?
I think it is. I still think we need to do more. And I think, again, the way that we message things at the center, Centro Salud es Cultura, is all through those values. So a Latino knows when family's being included or when respect is being included.
I'm
and
so
that
glad
works
you brought it
so
up
well.
because it is so remarkable how if you live in your European American bubble, you just have no idea that even something as simple as messaging matters.
Absolutely.
Even though that Latino friend of yours could live right down the street, the way that they are messaged to really could make or break.
And what we know we need is transcreation, not just translation. We need messages that are designed with the values of the community that we're trying to message to.
Give us a sense. Could you give us a differences?
Well, I mean, I think it's literally, you know, when I was first asked to translate things at Cal State Long Beach, it was literally the translation. Well, you know, you can't access your child's grades because they're 18 years old, or you can't, all the things you can't do by law, as opposed to the message that Latino families needed. Your child's in college, they're going to need a quiet place to study. They might not be able to go to all the family events on Sundays. So the message is different.
Reach to
all directed.
European Americans. Who cares
Yes.
if they don't come on Sundays?
Absolutely. So when we look at, you know, what is the context of the Latino community and Latino families, that's what needs to be heard, and that's the message we need to get across when we're dealing with healthcare.
The other issue with the Affordable Care Act, I know one of its goals is the question of prevention, because so many of those that are uninsured have used emergency rooms as their front line.
Yes.
And in order for the Affordable Care Act to work, we need to get folks into preventative care.
And
I mean, just well visits.
You know, and that's where I think we can make a difference as a university, and we're really striving to do that, because we need to train the next nurses, health educators, and we need to make sure that we reflect the populations we're serving. So, you know, at the center, we have about 80 to 90 first-generation educated Latino employees who are working with us on different efforts, from students, from graduate students, from folks with PhDs, on to we have promotoras or peer educators that are working in the community. These are the folks we need at the front line of our healthcare system.
For the Affordable Care Act to be successful, it needs a nice mix of old and infirm and young and healthy.
Absolutely.
Are Latino young and healthy? Are they accessing insurance?
We're trying to do that, and that's been some of the things we've been doing with the Spanish language, CNN en Español, and you know, bringing on some of our stars at the center who are much younger than me to really speak to the community.
Because honestly, this is not a Latino, Caucasian, African American issue. We need young to sign up, or the Affordable Care Act will go. It's a death spiral. I mean, you've heard that many times before.
Exactly.
I want to thank you so much for joining us. I really enjoyed meeting you. Please come back.
My pleasure.
When we come back, we're going to speak with Gary DeLong. He's a Long Beach City Council member. Get his sense of how Long Beach residents are acculturating to the Affordable Care Act on Brad Pomerance. It is Charter California Edition. Welcome back to Charter California Edition. I'm Britt Pomerance. Our guest, Gary DeLong. He is a member of the Long Beach City Council. And sir, I want to speak with you about the Affordable Care Act. I know you're not a state official, a federal official, but the reality is constituents talk to whomever will listen. And you're the closest. You know, you're Long Beach City Council. So constituents surely must be talking to you about the rollout. We're in California. We don't deal with healthcare.gov. We have covered California. What do you hear?
Well, you know, we are hearing quite a bit, particularly since October 1st when the rollout occurred.
Right.
Now, I don't get so many complaints about the website and those problems because people do understand that's not a local issue. But what I hear is individual stories from individual people that are, I don't know, if losing their health insurance or they're being forced to change from this plan to that plan and they like the old plan. Those are the complaints we hear.
I want to talk about that because, look, healthcare.gov, it will be resolved.
I believe it will.
Covered California is doing pretty well. But President Obama said on the record several times, if you like the plan you have, you can keep it. And the reality is that statement has many nuances that were not offered.
That's correct.
Grandfather clauses.
Exactly.
And we know that even though it's a small number of people who are losing the plan that they like,
yes,
it's still happening. And I'm just wondering, what are you hearing about that singular issue, this notion that if you like your plan, you can keep it, and that's not entirely true?
And that's the largest complaint that we're receiving. Again, it's people that are being forced to change that don't want to change. You know, those that were looking for health insurance choices or they didn't have insurance and this is an opportunity to get it, obviously they're very favorably impressed with the plan.
Cover California, it has its issues, but it's not healthcare.gov.
Exactly right. But we are hearing quite a bit. I'm just hoping that the federal government will get their arms around it and you'll see the problems decline, not continue to get worse.
At the same time, what's interesting about those that are losing their plans is they are losing their plans because the plans were substandard. They were subpar, pursuant to the Affordable Care Act. They didn't provide the coverage that would protect them. But yet that doesn't really address the fundamental issue that you were told, if you like your plan, you can keep it.
And candidly, that argument doesn't resonate with those people because although you and I might think those are subpar, it was working fine for them.
Right.
So we've taken that choice away.
Are Californians or Long Beach residents realizing that even though the national press is obsessed with healthcare.gov and its failings, that we don't operate under that?
Exactly.
We have covered California. But to people, is there a disconnect? Do Californians realize that we have a website that, while not perfect, is absolutely operational?
I don't know if there's a disconnect or not, but I can tell you I haven't gotten a single complaint about the failure of the federal government's website. You know, you read the headlines, the media makes a big deal out of it, but if you say, well, what are your constituents complaining to you about? They're complaining about things that matter to them, losing their plan, changes. They're not complaining about the sign-up process.
Interesting. I want to shift gears, if I may, sir, and ask you about the budget of Long Beach.
Yes.
And I use Long Beach as a metaphor for any medium to large size city in our state of California. So there's no question that the economy has turned around in California. It's hard to deny. We're not perfect. There are still issues. But government budgets are looking better.
Yes.
Be it Prop 30, who knows why, but government budgets are looking better.
Well, revenues are up.
Revenues are up.
Revenues are
for
up.
whatever reason.
Yeah.
That means that those that had not received pay raises, as an example, during the recession, they're coming home and they're saying, we want a pay raise now.
Sure.
Long Beach is not unique. We hear that up and down the state. Long Beach, though, recently had that scenario presented. Play it out for us.
Well, first of all, most of the news is good, right? Revenues are up in Long Beach. This is the first budget year in at least 6 or 7 years that we didn't start off saying we had a structural deficit, so we had to cut something to plug the hole. So that's the good news. And I agree with you. Many of our employees had been without raises for 5 years. Cost of living continues to go up. So they were technically making less money today than they did 5 years ago. And it was important to address that.
And so it is true that in Long Beach, there were no raises for 5 years.
For some groups.
For some groups. Okay.
Fire and police did negotiate some raises throughout the process, but there are 4 labor groups, one of them being a management union, but there are 4 labor groups that did not receive raises in 5 years. Unfortunately, I had to vote against those raises recently.
But be specific. What exactly, what plan was put before you?
A 15% raise for those 4 groups. And I thought that was a little steep.
So let's talk about that.
But honestly, it's actually 9% because they gave 6% back to their pension. So it's 15%, but it was a net 9 to the employee.
So let's talk about that, because if I hear someone's getting a 15% raise, boy, that's hefty.
And it was done indiscriminately. And that was my biggest issue with it is, for example, in the management ranks, I believe raises should be based on merit.
Okay, but let's...
And these were across the board.
But let's talk about that number, 15%. It's a hefty number. But one could argue, sir, that it really is 3% a year for the last 5 years that they should have gotten anyway.
Sure. Well, but I would disagree with the should have gotten anyway, because government needs to learn to live within its means, right? So you should not give out raises that you can't afford. You have to say, what can I afford to make sure I'm providing all the services that we should to our residents, and then with what's left over, let's invest it in our workforce and the community.
Have you made comparisons to the private sector? Do we have a sense as to whether the private sector is kind of piling up the raises they would have given and now giving them now?
Well, I've looked at both the private sector and the public sector, and I can tell you from a private sector perspective, people are not giving 15% across the, or 9% across the board raises. And you look at the county of Los Angeles, which I believe is extraordinarily well run, very fiscally conservative over there. They do a great job, the supervisors. They haven't given raises for 5 years for any of their employees. And even now, they're negotiating raises in the 4 to 6% raise, not 15%.
So, in the end, the Long Beach City Council voted 6 to 3,
yes,
to support the raises.
That's correct.
Okay.
And I want to be clear. I mean, we have a number of outstanding employees. They do a great job for our residences, so they deserve a raise, but we shouldn't give them a larger raise than we can afford.
Can the mayor weigh in? Is there a veto?
The mayor can always veto an action by the city council.
And how is it overridden if needed?
It would take 6 votes to override it.
Okay, so we don't know where we're going on that front, but are you afraid?
But I think the mayor is compassionate, and the mayor did see a reasonable need to increase some employee compensation.
So what do you think will happen? I mean, 15% for 4 bargaining units, that's a significant number. Is this going to cause a hiccup in the positive financial news we've seen in the Long Beach budget?
Well, I don't think it's going to be a huge hiccup, but for example, we were hoping to restore a fire engine this year, and I can tell you that's not going to happen now because some state funding that we are anticipating is not going to come in. And we could have used this other funding, but now we've agreed to give raises. So that's one example of something that won't happen because of the raises.
Have you heard much from your constituents on this question?
Yeah, people are pretty frustrated about it. Again, it's not because they don't recognize that the City of Long Beach employees do a great job. It just seems that that percentage is a little over the top. And again, most people think raises should be based on merit. You shouldn't get a raise just for showing up. And if you work twice as hard as the person next to you, why wouldn't you get a larger raise than they would?
So why is it not based on merit? I mean, why wasn't there some type of formula created whereby there's a range?
We had a poor process in this one. There was this proposal. It came to the City Council in closed session in July, and it was just immediately adopted. There wasn't a lot of discussion. We didn't have it over 2 or 3 meetings. There was one meeting, and it was just done.
Some good news, though, in Long Beach.
Oh, we have some great news.
Very good news. And, of course, you're on the beautiful shore. And you have spoken with us about the Belmont Aquatic Pool. I do want to talk about it because it is good news, even for our state viewers.
Yeah, we have a lot of great things going in Long Beach. And our capital projects fund, what we call the Tidelands Fund, is healthy. It's funded by predominantly oil revenues, and obviously oil is doing very well these days. So we're rebuilding the Leeway Sailing Center. We have a lot of great things on our beaches, but the one you referred to is really going to be iconic for the city.
Tell us.
It's a Belmont Aquatic facility. It'll be one of 2 west of the Mississippi that'll have a 10-meter high dive indoor diving well.
Just 2?
Just 2.
Who's the other?
Federal Way in Washington and Long Beach, and Federal Way is not on the beach either, by the way, in Washington. So it's going to be tremendous.
How did this happen?
Well, this happened really from community support. Well, the bad news is we had a seismic issue with the existing facility. We had to close it down earlier this year, and we said, what should we do? Well, we decided to look at our history. And in Long Beach, when that pool was built in 1968 for the men's Olympic trials, we had NCAA championships in the 70s, and then the pool got outdated. So we started looking at it. We have a lot of Olympians in Long Beach, and some of the aquatic Olympians came forward and said, let's recreate Long Beach history. Let's go back to where we were. Let's have a world-class facility.
Congratulations. Congratulations. His name is Gary DeLong. He is a member of the Long Beach City Council. My name is Brad Pomerance. We thank you so much for watching Charter California Edition.